Namaste, I am Dr. Nitin Patil. Today I have with me Dr. Banuprakash from Bangalore. He is basically M.B.B.S, M.S neurosurgery. If you read him, he is basically a social reformer more than a doctor. I met him in a Kochi, so we are here for a urine therapy conference. Just first, I wish to know how you got introduced to urine therapy.
Okay. To tell you frankly, when I read about Morarji Desai sir drinking his own urine during my childhood, I was curious how it tasted.
Yeah.
So I tasted that, and then I started reading about Ayurveda, homeopathy, allopathy, and all before in my plus 1 and plus 2. And then I wanted to integrate all the branches of medicine so that the best option for at that point of time for the patient would be, and the affordable option should be available. So I did my neurosurgery, and after that when I started integrating all the branches of medicine, creating a holistic protocol of treatment for patients, then I was reintroduced to urine therapy. But even before that, during my neurosurgery and my medical career, we have used urea for decreasing the brain edema.
Okay.
Historically, that is what we have been taught, and we use urokinase, an enzyme extracted from the urine, which we put it into the brain cavities whenever there is a clot in the brain cavity which is not coming out on its own. So we put that urokinase enzyme that will dissolve the clot, and then it will come out of the tube which we have put for decreasing the pressure of the brain. And that same injection, I'm not sure anybody else has used it before, but I have used it in the VP shunt, what we call ventriculoperitoneal shunts, when they are blocked. And when I inject into the chamber of the ventriculoperitoneal shunt, the blocked shunt used to open up. So that avoids a surgery for a patient who has already been put a shunt. And then later and also in the neurohormonal this thing, we have been taught that the menopausal women's urine contains a lot of follicular stimulating hormone and the luteinizing hormone LH, FSH, and GnRH, and that was used for treating infertility in patients before these hormones were produced synthetically. Yeah. And now that they have been produced synthetically, nobody talks about it. But when I try to integrate the branches of medicine, when they say a drug in multiple dilutions, like what we call homeopathic doses, can create the same effect as when it is given in a strong dose, then I feel that somewhere taking care of the elderly would have improved the fertility of the younger generation.
Yes.
So these are the connecting things which when you connect different things in different perspectives, then you get these ideas. So but to the opposite, what we did in COVID is we dumped the elders, we dumped the sick, and we were like, and even when you look at a virus, getting a virus from an infected person is like the person would have broken down the virus. So when we help him to recover, we are being vaccinated naturally. So these are the concepts which I have been thinking over the past 2-3 years after the COVID. Then I realized the importance of the social structure, the family structure, the sense of helping and caregiving and living and let live concept, the love and let love concept. So when these concepts, when I try to, like the Samudra Manthan of it, like how SHIVAMBU came, that's how thanks to Thampi Nagaraj sir, who introduced me to the effects of these things. And now when I came to the conference, listening to most of these speakers, I'm much more bombarded with so many facts that definitely this is one modality of treatment which is suffered a lot, which is not popularized, which is looked down upon, but still definitely it is the most natural way of healing.
Actually, there are very few doctors who are ready to integrate different faculties into one form. And as you are interested in integrating all this homeopathy, Ayurveda, and naturopathy and everything, and it's very nice to hear about the urokinase. Actually, we as a urine therapist, we tell people that yes, there are many cardiologists, many neurologists, they use urokinase to dissolve these blood clots. Okay, so how much it costs generally, this urokinase?
See, urokinase was one of the first drug which was used to treat strokes also. But later there are some patients developed problems with the increased bleeding, so they made what is called tenecteplase, which is a recombinant tissue plasminogen activator (TPA) enzyme. So when they could produce it chemically, they stopped using the original thing.
Okay.
But what if, and that it is so costly, 50,000 rupees when a patient comes with stroke, and definitely they, you say some poor person to get 50,000, where will he get from? So such sort of a big looting of people in the crisis time, when they are emotionally charged, when the relative wants some benefit to the patient at whatever cost. Maybe they might have to sell their land, sell their house, sell their destroy their future plans of life. So that is the financial burden of allopathy. When we look at that, and when we find alternatives for that, something like naturopathy, if somebody has a chest pain, if he chews ginger in his mouth, the essence of ginger, the natural alkaloids in it, will lyse the clots, will improve the blood circulation. So similarly, maybe doing gargle with the urine might give the essential enzymes into the body and lyse the clot. So let us understand the different paradigms and possibilities which are cheaper and easier and easily available, locally available. If somebody has a chest pain somewhere far in the forest or somewhere when he is alone, if somebody is so sick, nobody is there around to take him, maybe a few drops of urine, a little bit of urine he can gargle, yes. Probably that might save his life, save him from the heart attack or the stroke. So such sort of innovative thinking and lateral thinking and out of the box thinking should be incorporated, so that we all can have health at the best at our own homes, in our own homes, and in our without any much cost.
Generally, for a layman patient, taking injection is not a problem. Okay, whatever doctor gives in injection, they are ready to take. But as a doctor, how do you think about oral administration of a urine?
See, definitely it is a mind block, thought block, that's all. Once you come out of it, initially I also had that, even though I experimented as a kid, but I couldn't continue it because of some thought blocks again. But now what I feel is, we will understand what is the quality of our urine when we are eating junk food, and how bitter it tastes, how pungent it becomes, or how something like irritating or burning sensation when you are passing. So many people would have experienced, but the taste nobody would have, not many people would have understood the bitterness or the pungency in it. So when we learn that, then definitely it is a big eye opener for us to eat healthy, eat good food, sattvic food, so that our urine itself becomes very light colored and without any bad odor or bad taste. So that is when we need, it's a feedback. It's a feedback, natural feedback which we need to have, so that we can change our lifestyle, change our stress. I don't know, maybe even if you are eating only fruits, if you are stressed up in your mind, if your thoughts are frustration or anger, probably your urine might be bitter. So such sort of a analysis of SHIVAMBU and urine therapy should happen.
Yes. Generally, whenever we talk to normal people, first thing that we talk about that it has an ancient history. Lord Shiva has told Parvati, there are 107 shlokas in Tantra Yoga and all that. People accept that, but they have that mental block that stool and urine, there is excreted out of body, this is waste. So what would you like to say about this physiologically? What you will explain that how urine is pure and how we can take it back?
See, definitely when microbiologically when we look at urine, and pathologically when you look at urine, we say that it is there are some excreted elements in it like urea and some bacteria also can happen. But bacteria are there in our mouth also. Viruses are there in our mouth also. Fungi are there. So the commensals are everywhere. And when you want to integrate things here, regarding stool, definitely it's a very obnoxious thing. But even allopathic, our preventive and social medicine textbook says the river is the connection between the the anus of the people who are living upstream to the mouths of the people who are living downstream. So, and you have heard about Dr. B.M.B.S. famous poop pill. So, definitely when our intestine and colon flora are not in the right combination, the flora is not good, probably we need to replenish them, and allopathy is doing it in a different way. Like we have this introgermina capsules which contain, I always tell people, drink the clear fluid of the buttermilk. That contains a good amount of bacteria, the yeast cells, and so we need to touch the soil every day. We need to drink natural water from springs. We need to breathe in fresh air. That is how we can be integrated with the natural biome, the live and let live with all the organisms of the world. So that is what is the spirit of recycling and taking it back. So definitely taking one's own urine will give a feedback to the body and brain that this is what we are putting out, this is what is inside, this is what is the process. And now Dr. Jaspal, since he presented a Lancet journal, it says that patients will be, in the urine, they will be excreting cancer cells, the antigens of the cancer cells, and when you take those antigens, your body will recognize it as antigen and produce antibodies to that. So you are healing your cancer. So that is and for that, the genetic labs will process cancer cells, take out the antigens and give it to you as an injection at huge price of thousands and lakhs of rupees. You can drink your own urine and get those antigens. So such sort of analysis we need to understand, and definitely I'll put you in a different way. When Kama Sutra tells all the postures and all the different possibilities of love making, definitely it is a sort of loving your own self and loving your own partner. So definitely that is a way of getting the antigens and getting the so that it is the cycle of immunity, the body's response and the body's analysis is maintained by that.
Yes. Generally in naturopathy, what we say is any disease is because of an accumulation of toxins, and especially the nitrogenous compounds we found in human urine. When we take it back, first thing what we observe is it detoxifies the body. Okay. So generally many people are constipated so much, they are hyperacidic, and first thing the bliss or the joy of empty bowel is only known by urine therapy practitioners. Okay, so it works as a very good detoxifier, but in the same way it works as a hormonal balancer. As you said, there are many gynecological drugs also, especially nowadays there are many people suffering from an infertility problem. So for that we have heard that there is a prophecy, urea politropine. These are the hormonal balancing drugs which are being manufactured from human urine. So how do you think that how it may be working? Like it works as a hormonal balancer as well.
See, definitely, if a postmenopausal woman who is already secreting a lot of LH and FSH, when they have what we call when some patients develop what we call hot flushes and the bone mineral density decrease, probably when they take it back, probably they are reusing their own hormones.
Yes.
So that is one possibility wherein we can, because the kidneys are leaky and that's why it is going out, or is it overproduced and it is not being utilized, or what is going waste we are recycling it. So when these possibilities of scientific analysis are considered, then we will know the wholesome truth of health and life. So until unless we understand that, rather than just what do you say, thinking very loosely about something good as Shivambu would be a bad precedence for the truthful scientific integrated knowledge. I'll tell. So let us analyze things, let us practice it, let us see the benefit. For my mother only, she has a diabetic foot and she had a non-healing ulcer. So now we were giving her ecosprin, clopidogrel, silastrazole and other things, and antibiotics also. And then I thought, let us use this. So she has been immersing her feet into the urine tub, and definitely the healing has been better. So that has been noticed as you have presented also in some of your patients. So definitely when there are benefits, and urea was used to decrease the brain edema. So what if, how much of absorption can happen? We don't know. And if somebody is ridiculing urea as a thing, we are putting it in the soil. It's coming in our plants, it's coming in our vegetables, it's coming in our food. How different is that urea and this urea? And sometimes I just make a joke saying that so much of urea we are putting might be causing more uric acid levels in our so that's why many people are having joint pains. So definitely we need to look at it in a holistic way, with a sense of inclusivity and tolerance for all possibilities, and understand the benefits. And why? Because the global crisis, medical crisis of costly care with unaffordability and inaccessibility for the so-called allopathic care, which is being overpushed by all the governments across the world, and which is more centralized and more corruptible, because we saw remdesivir, which didn't make any much benefit, was being pushed at and I mean a killer injection was pushed as a vaccine for COVID, and definitely with such sort of a what do you say, assault, a genocide that is happening in this world. I mean, definitely people should have access and knowledge and mindset for healing themselves with the local resources.
As yesterday's talk, you were talking about the mind also. In last century, what we used to say in my father's time, that there are more than 70% diseases are psychosomatic in nature. Now in 2023, we are saying that more than 95% diseases are psychosomatic in nature. Especially after the corona pandemic, there is so much of anxiety, there is so much of depression, there is a saturation even in medical fraternity as well. So patients doesn't know what to do, and because of that they have so much of nocebo as well as placebo effects, and they are going through. So what I wish to know from you is that how urine therapy can be useful even on a psychological aspects.
See, first thing is, I mean, to the most critical allopath, I'll tell you, let it be a placebo.
Yeah.
And then I tell you, if somebody is so determined to improve his health to the extent that he can drink his urine, definitely he will follow all other steps of sattvic food, changing his mindset and everything. So it's like, it's not an acid test, it's a urine test of changing the mindset of patients.
Okay.
So when we test that, I mean, definitely, as you said, many of the patients who are skeptical about taking urine, when they look at other patients, drinking urine and knowing the benefits, they do start. So probably somebody who would be skeptical of the urine test will come out of that acid mindset and start urine consumption when they see others. So definitely let us, consider the possibility first. Understand the possibility, because Singh sir was presenting a boy who was racked to drink his own urine. After he learned that urine has so many benefits, he took back his complaint against his seniors. So that is how is the mindset that works. Because a person who feels that, and there are few people who have been made to drink in the ragging, and they would have gone and committed suicide, because they think that that is something bad, that is something. So that is the power of mind. and definitely psychosomatic diseases are far worse. We are seeing patients having fits, seizures, even after giving 4 drugs to stop the seizures, especially for those who have been infected with COVID virus, or after injection, those who have the thrombosis of the cerebral sinus veins. So such patients need 5 drugs of anticonvulsants, and when we are seeing such scenario, to calm the mind, to take the mind under control, the resolution which a person needs is tested by the urine test, I think.
Yes, yes. And how it can help to balance our body-mind relationship. Actually, there are many, even diabetes, blood pressure, heart disease. This is all caused because of a mental stress. And what we say is urine therapy has a holistic approach. So in that context, what is your opinion?
See, urine therapy, it's not somebody who is eating all junk food and then drinking his urine. It is a holistic, it is part of the holistic therapy, wherein the mindset change is there, and then the diet change is there, lifestyle change is there, along with urine therapy. And it's like the chicken or the egg, what comes first, whether taking urine is the beginning or taking urine is the consequence. So definitely start has to be made. So now once you start taking urine, probably our own biofeedback will create a sense of calmness into us, and gives us the understanding what is the truth. Because I'll tell you, there is a subconscious mind, there is a subconscious autonomic nervous system which auto-tunes itself. It can't tune by the reports of our labs. It can tune by the report of our urine. So that is what I can say as a best feedback mechanism for into our own subconscious mind and the autonomic nervous system to retune itself to what is happening.
In our center, we give generally long fasting, like 7 days, 8 days, even 20 days fasting they do on a urine. And we have seen patients, they are very habitually, they are angersome, somebody has some tendencies of anger and all that. So to break these habits, what we have found is when they go for a long fasting, during fasting, there is a substantial change in their behavior also. Okay. So is it something that physiological or psychologically it may be working?
See, psychology is a consequence of the physiology.
Yes.
I'll tell you. If somebody can tolerate fasting, he has won half the game.
Yes.
So that is why Langanam Paramoshadam. Fasting is the biggest medicine. So if somebody can fast, he has gone to one level of mind control, then he can accept his own body fluid for a feedback mechanism, for a healing. Then definitely he has achieved another level of understanding of the truth of universe. So that is how it helps both physiologically and psychologically to ensure that person heals. And definitely people who are like angry, frustrated, depressed, or even addicted, they have a different pattern of thinking and attitude, which needs this, I think, urine test probably.
Yes.
So,
yes. Lastly, I would like to ask you, as you have come forward and you are talking about urine therapy, the benefits of urine therapy. There are many people now, they are listening to you. How is the future for urine therapy?
see, definitely the future is good, because when you look at so many benefits and when you look at the affordability, the availability, I think many people definitely, especially the poor, should. I think the message should go out in local languages, in the local accent, so that it reaches out to many people. Then people will accept it. Then people will be. It creates awareness, and with the way the healthcare, what we call the imposed popular allopathic healthcare what I call the being pushed upon the societies across the world, humanity across the world by the big corporates is going in a wrong way, is going in a destructive way with the genocide of the COVID and COVID injections. I think people will realize the wrongs in it and go back to natural ways and the herbal ways and definitely heal themselves, and that would be a more decentralized health and medicine in your own hands, in your own body.
Yes. So
Movement.
yes. So wherever there is a disease, there is a medicine. Okay. So the medicines which is flowing out of our body can heal ourselves. So what are the chances that many other faculty doctors will come forward and we can unite together and we can serve for the society?
See, there is a major hindrance by the media for truthful information reaching from the common man. So, be it policy making or medicine itself or lifestyle, or because there is money in petrochemical industries and there is money in marketing and money in all the healing industry. It is called sickness industry, I call it, because they really are not healing, they are just temporarily creating some magical cetrites so that in the short term you feel better but you are still sick in the long term. So such sort of a sham care is happening in the so-called sickness industry, and definitely people will come forward, choose alternative. After COVID, definitely, I'll tell you, the allopathic ivory towers of sickness care, the hospitals have looked at patients like untouchables. Have looked at sick people like untouchables, and they have dumped people like logs. So that is the karma of allopathy. That is the karma of the COVID mafia, which they will have to earn, repeat, and they will suffer through it, and that is the karma of allopathy. And that definitely people will be more intelligent to choose a holistic approach. Definitely, the magical benefits of petrochemical drugs, whenever the problem is very severe, is still there. I still believe it, because probably the ego of being an allopathic doctor. But still, we need to incorporate all other modalities of Ayurveda, homeopathy, naturopathy, and our own fasting and meditation, so that we are holistically healthy and we become much more stronger to an extent that we can withstand the onslaught of the radiation damage like the 5G, 6G, and we should create counter radiation of tele-suggestion, and we need to ensure that. So such sort of a superhuman capabilities can be achieved by a holistic approach.
Yes. At our center, we have a slogan that for urine therapy, what we say is first choice or last resort. Okay. If you choose, if you make your first choice, it is good. Otherwise, lastly, you have to accept and you have to come. There are many terminally ill patients. That is the only hope.
Okay. Recently, I suggested this to two cancer patients who one is my relative, another one is a friend of mine. So probably that is, as I said, last resort. And probably a few of the patients who have some, one of my cousin who has a psoriatic patch, eczematous patch, I suggested her. She said some 10 years ago when we went to Rajasthan, somebody told this, we laughed at it. No, you are also telling it. So that is how probably reinforcements need to happen at by multiple people to the same person, for them to realize that it could be beneficial, and they start using it. So hope this this get together, creating a understanding among each other, will bring out more people to start using it and taking the benefits out of it. And ultimately, it will definitely create a better sense, truthful sense of health, not the pseudoscience. See, they said your hands can transmit coronavirus, wash it with stellium. So many washed and they got fungal infections. And then I realized 2 years ago that these chemicals are not the answer. I stopped using any soap. I just take bath with water. Previously, I used to take bath with warm water. Now, over the past 10 days, I have started using only cold water, and I don't use toothpaste. I just brush it with my finger. Some very rarely I use a tooth powder. So this is what is the truth we need to understand. What is it? The scam of fluoride in our toothpaste, the soaps which are polluting our lakes. So until unless we reach out to the last consequence of each step, the carbon footprint of our life, that is what is the karma of our life. So that is what we need to understand, the karma of our thoughts, our words and our actions. Until unless we keep a watch on that, we can't be healthy and we can't be happy.
Lastly, one question that for a common person, is it any harm in drinking urine?
See, after looking at all the experiences from different people, I feel no. Even I have used it and I don't feel any problem with that. And looking at, the worst scenario would be something wherein your urine is very foul smelling, it is having some infection which is like you are having a bloody urine because of a stone, kidney stone, or you are having something like milky urine which is all totally infected. I don't think anything, the regular urine should not be of any problem. Even once when I had some burning sensation in the urine and it was very dark yellow, I tried to taste it. It will taste a bit bitter and pungent, but I don't think that will cause any harm. So definitely, looking at so many experiences, definitely I don't think it should cause any harm.
Yes. So we are very thankful, very grateful to you. You have come in the conference and you have talked to us. Okay, very, very thankful.
So this is what my gratitude to the urine which has given so many hormones for the allopathy to develop to this level and earn so much of money. But we need to give it back the credit. So that is what I feel as the real dharma of allopathy.
So thank you very much.